Hi Revivers, Dr. Lin here at Rehab and Revive Physical Therapy. Hope you're all having a great day. I bet you tuned into this segment because you wanted to learn about how to tape your knees so you can run better or run safely or run out of pain. So stay tuned, we've got that coming up next. Alright Griffin, cue the music. And here we go. Alright, so we've got Kinesio tape, Kinesio Tex. Now there's a bunch of like random companies that are out there, other people are promoting. As a therapist for the last 15 years, this is the only tape, the OG tape, that I can recommend. And so this is the only one we use here at the clinic. So Kinesio Tex by, I don't know, Case Kenzo, I believe. So check that out. But you want, I'm going to wear hot pink today. No one's going to know except for me because I just throw on my trousers over. So three squares is what you want you want 2 strips of 3 squares. So we're gonna do that next. All right, so we're gonna start our cutting. So you need about 3 squares. Measure that out. Here it is again. All right, so we want to cut that through. This stuff's super sticky, but all you need is about that much. So 3 squares. You want it even. Now, if you have a knee tracking issue, a lot of times people track incorrectly on the outside of the knee. So now you want to round this. So I generally just kind of put these together here. Rounding the edges makes life a lot easier. And the reason is that it doesn't catch on your pants or your sweats or whatnot. And so we're going to try to make this look prettier. We had a former therapist that did this much better, but I'm gonna do my best to give it justice. So you want to go to about close to 2 squares to cut it. So you're basically creating this kind of layer. Now you also want to round this guy. So let's go ahead and round this guy, and that should be pretty good. All right. Once again, trying to make this look pretty. I learned this taping technique probably my first 6 months as a PT. So you got 2 of these, and this is gonna go right over the knee, and we're gonna show you how. So we're gonna use my left knee, and some of you may know I've had my ACL reconstruction, meniscal reconstruction on both sides. So sometimes it gets a little wonky. Sometimes it makes noises, sometimes it doesn't. When it does make noises, that's when I throw on one of these guys. Definitely hot pink is my flavor. So what we're gonna do next is I'm gonna show you what we're gonna do. So we're gonna overlay this. Let me show you kind of how it's gonna look. Now what's gonna happen is this stuff is really stretchy. You'll see that. It kind of stretches. This is 100% stretch, and this is like 10-25%. That's all you really need. You're gonna, since you can see my knee kind of kinks outside, and that's just kind of what has happened after my meniscus has been shaved. You want to be able to push that in. So you want to be able to push that in. So you put more tension here and less tension here. You'll kind of see how that legs works. So I generally like to put the bottom one on first. So that's about your kneecap here. There's a little bony protuberance here. So we're gonna use that guy as our. So I generally want to just use this first, and it's easy to rip because it's stretchy. And so what we're gonna do here is then you're gonna throw this. Obviously, if you have shaved legs versus having hair, much easier. But this is what we're working with today. So what we're gonna do next is that's when I start putting about 25 to 20% stretch. And as I do that, I'm just going ahead and going around, kind of like creating a bumper. So that's all it is. That's what it looks like. This one, you don't even need to put stretch. The inside one, you just kind of just lay that down, like so. Right there. Okay, so you can see this one goes a little higher, and that's, like I said, that extra 25% pull. Now this one is about a thumb, like digits worth. So we want to do that. Once again, I kind of do this part first and leave the rest of the legs so I can just lay it down pretty easily. So that's about a thumb's worth, kind of split here. So and so once again, the lateral side is what I'm going for first. So I want to go outside. I'm going to pull, right through there. And that's that. And this one, guess what? You're just gonna lay it down, and that's all you really need. And so what's gonna do is, as I bend my knee, it's gonna push it inside. And so if you need more protection and your kneecap tends to go inside, then you want to push it outside. But that's you're just basically creating a little bumper, right? Like that. So feels great, lots of support. You can generally wash and take a bath, or I mean not take a bath, take a shower. You generally can take a shower, and it'll last like 2 or 3 days, and then you can take it off. If it irritates your skin, run it under warm water and peel it off. And there you have it. We're back. You can see my knee is wonderfully in pink. No one's gonna know what's underneath because I'm gonna go treat patients right now. So, but yeah, check that out. You can see how it stays relatively in the right groove. That's our plan. Like I said, use Kinesiotex. I think the other ones are less sticky. I've tried them out, but this is my personal preference. Make sure this is the right thing to do for your knee. Sometimes taping this may actually hurt you or harm you. So check with your healthcare professional. If you like what we're doing, please subscribe below, leave some likes, any comments. We're happy to help, comment back when we have a free minute. And if you have any more questions, you can email us at rehabandrevivemedia@gmail.com. I'm Dr. Lin of Rehab and Revive. Remember, we heal smarter, not harder.